Hello everyone, welcome to my channel. Today I'm going to discuss the topic the professional misconduct, also known as infamous conduct. So the definition of this it is like a disgraceful or dishonorable act of a doctor or a disgraceful or a dishonorable act that is done by a doctor, the professional misconduct. Actually, what are the acts that we considered as disgraceful or dishonorable? So we have a list of the acts. Those include, firstly, adultery. It is having a sexual relations with uh, between a married person. Like if a doctor has a sexual relationship with a married person other than his wife or a husband, is known as adultery. And advertisement. So, signboard. Doctor should be unusually sorry. Signboard should not be unusually large. Should mention doctor's name, degree, specialty, and university. Like they'll keep that board right before the hospital, so it's like it should not be large. It seems, and it should not be placed where doctor does not reside or work. Like it should be present only where the doctor works. It should not be present where the doctor does not work, and fee should not be displayed on it. Okay, lay press means like a doctor cannot publish a reports of cases treated by him or her. Like if he may, like if he treats cases, so he should not publish the report that he had treated. So he cannot bring out the reports into the public that has treated. Where am I? Okay. But she can write or talk on radios, TVs on matter regarding the public health and precautions to avoid diseases. So it is easy to understand. Next, institutes like maternity home, house for blind, house for mentally retarded can advertise, but the name of the doctor should not be mentioned. Okay, a doctor can advertise his starting of the practice or restarting after a long period or change of address. Okay, she can do it her only for twice. Okay, if at all the doctor, if we are he started a new hospital, or he's done in one place but he's changing the address, so then he can advertise like he's changing the address or he's starting a new hospital, and he have to do it only for twice it seems. That is the case, like in advertisements. Association, association with unqualified persons, like employing persons to procure patients. Like association means it means like we should not employ people who are not qualified for the procuring patients. Okay, covering assisting persons who have no medical qualification for treatment. So we should not assist the persons who have no medical qualification, who is not a registered medical practitioner. So like we should like while performing this, if at all a person is not a registered medical practitioner, so we should not assist him or encourage him like doing all these surgeries and all. It comes under the covering. And dichotomy, like we all know, it is fee splitting. Fee splitting or receiving or giving benefits to professional colleagues, or chemists, laboratories, or manufacturing firms. Fee splitting is like if at all there's a person, and he'll like if it's person like RMP and all, then what he'll do is like he'll ask all the people in the village to go to that hospital, like particular hospital. Then if at all he'll charge, for example, he'll charge 300, then he will give 100 or 150 to this person RMP. So this is known as fee splitting. So we should not do this fee splitting or dichotomy. And false certificates, issuing false medical certificates and reports like birth, death, sickness certificates, this we know. And sex determination, like we should not determine the sex, so we should not say the sex of the like of the baby. Next, employing agents or procuring pay or procuring patients. Okay, refusing to treat patients on religious ground. Okay, we should not do that. And criminal abortions should not perform criminal abortion. So what are the offenses or acts include? Adultery, advertisement, association, covering, dichotomy, false certificates, sex determination, selling drugs. Okay, I didn't explain the selling drugs. Cannot run a open shop but can dispense medication on his or her patients. Okay, employing agents, refusing to treat. Okay, and criminal abortions and more. We have what is this? Mm, Okay, disclosing secrets, like we should not disclose the secrets of the patients. Only we have to disclose it in privileged communication. So, yeah. Next, torture. Should not assess torture and consent, like failure to take consent for treatment and investigations or surgeries. We have to take consent. Even if we touch the patient, before we touch the patient, we have to take the consent and should not accept gifts and using unsterile instruments. Okay, these are the things we have to remember. And okay, like what is the punishment they give for the professional misconduct or infamous conduct? So, uh, if a doctor is found guilt of any of these offenses, he she may be warned. Firstly, if at all they came to know about it, they will warn. For the first time, they'll warn the doctor. If again he repeats it. So based on the mm, so based on the what? Based on the degree of the like offense. So based on that, they will regard him some punishment. He'll grant him some punishment. Like penal erasure, name is erased from the medical register temporarily. So erasure of the name may be temporary or permanent. So penal erasure, name is erased from the medical register temporarily. Professional death sentence. See, we know death sentence, but they're erasing the name. So professional death sentence. So name is erased from the medical register permanent. This is professional death sentence. Okay. Okay. Doctor loses all his privilege to practice medicine. So yeah, this is what. So they may erase a name temporarily or permanently. Penal erasure or professional death sentence. Okay. Now, like how they will do? What is the procedure? Like, so if at all there is a complaint against the doctor that he done some professional misconduct, then complaint against the doctor. Like they will complaint or appeal to the state medical council. So complaint against the doctor, they will like appeal to the state medical council. So now what the state medical council will do? Will do inquiry whether the doctor is really guilt or not. He'll just investigate. It starts with the investigations. So after the investigations, he'll give the chance to the doctor like why he done that, in what circumstances that he done, and what made him to do all this. He will, like state medical council gives opportunity to doctor to be heard in person or pleader. Like if doctor want to explain himself, he can. Otherwise, he can. Doctor can appoint a lawyer who can speak behalf of him. So pleader is a lawyer. So yeah, the state medical council gives a chance for the doctor. Then like if a doctor is found guilt, then after all the investigation, if doctor is found guilt, then the state medical council awards him the punishment. What is the punishment? Like penal erasure or professional death sentence. If at all the doctor is not satisfied, if he feels that like it is not appropriate, that what so the what is that, it's not appropriate what they gave, so then he can go for if not satisfied with that, then he can, the doctor can appeal to the medical council of India. So if doctor is not satisfied by the state medical council, he can appeal to the medical council of India. So yeah, this is what actually, so all this explains this here, so you can, this is like this much is enough. Thank you guys.